Hello, my dear viewers. Welcome back to your health channel. It's Sri Lanka Health Podcast, and it's my gentle reminder to subscribe my channel and also please leave a comment mentioning that I have subscribed your channel. Thank you very much. Coming back to the topic, it's about a cause of chest pain, and this is the last topic I'm talking about in a video about a cause of chest pain. Today we'll discuss few things about costochondritis. What is costochondritis? Costochondritis is inflammation of the rib cage. It's not all the rib cage, it's about joints in the rib cage. Mainly joints in the front of the chest are affected usually. There is a central bone in the chest, which is a chest bone. It is called sternum in anatomy. And there are ribs coming through from the sides to the center and make joints with the sternum, the chest bone, and makes this rib cage in front. Behind, these ribs goes all round and joined with the spine, and that's how rib cage is made. Then then you can realize there are several joints types and several joints in the rib cage. These joints can get inflamed, and it is a frequent cause of chest pain in young adults. And I would explain in couple of minutes time that what are the presentation of this chest pain, that because this kind of chest pain is very common, and also it can mimic other sinister causes of chest pain. Like, patients do think it can be a presentation of heart attack, and patients may think that they may be having some infection, pneumonia. Patient may think they were having some clot in the lung, and this kind of chest pain can trigger a lot of anxiety and panic in most of the patients. And that kind of panic and anxiety sometimes may be justifiable as well, because you may need some kind of trigger to go to your doctor when you have some chest pain, because chest pain is not a complaint to be assessed by the patient himself or his friends or neighbors. Chest pain is a complaint which should be addressed by a healthcare person. Therefore, that kind of anxiety or panic may be justifiable sometime. Okay, coming back to the topic, what are the presentation of this kind of chest pain? Patients will come and complain whether usually when they enter the consultation room, what doctors tend to see is an anxious and patient who speaks fast and who wants to explain quickly everything, and maybe patient can't talk full sentences because of anxiety, and maybe patient little bit shivery, and also and patient may complain about that he can't complete the consultation because I'm very panic, I'm anxious, and I want to rest, like that. Therefore, overall, you may find a patient as a doctor, a clinician, who's an anxious patient. That's generally how some fair proportion of patients of costochondritis can come to you. And other proportion of patients may be not anxious but little bit worried about this chest pain. And when you ask the site of the chest pain from the patient shows with one or two fingers one side, or couple of, or maybe three or four sides. That means pain is usually not diffuse. Pain is localized to certain places. Obviously, we know inflammation of these joints is the reason for costochondritis. Then joints are not all over. Joints are usually towards the center and by the sides of midline, and joints are localized, and it causes localized pain. Therefore, patients tend to show the patient places of chest pain. Additionally, they may explain something similar to pleurotic type chest pain. What is pleurotic type chest pain? It is the chest pain which occurs at the depth of respiration, which is due to most likely to pleurisy, inflammation of the pleura. And usually, pleurotic type chest pain occurs towards the sides of the chest. But in this case, in costochondritis, patients complain pain towards the center of the chest and in the midline. And they complain kind of chest pain which occurs at the depth of inspiration. That's how they come. At the depth of respiration, they feel something, and if you ask the patient to get a deep breath, and patient may complain of chest pain at one side, and maybe a couple of sides, and that is a typical presentation of costochondritis. And what kind of treatment is available for this chest pain? And depending on the allergy profile and drug intolerance profile, patient can decide about his painkillers, and a doctor may recommend non-steroid anti-inflammatory drugs, paracetamol, cocodamol. Most of the times you may not need a prescription, but you can get the medications over the counter. But the decision to be treated with painkillers should be finalized by a clinician, because, as I always say, any cause of chest pain should be triaged and should be investigated and should be treated properly. And this kind of diagnosis can only be elicited after effective consultation. Therefore, this video gives you valuable information to understand pathophysiology of chest pain, and kind of conversation with your doctor may be supported by listening to this kind of videos, but it's not for the diagnosis made by yourself. Okay, costochondritis, back into the topic, right? Then inflammation of the chest, basically inflammation of the rib cage, and more specifically inflammation of the joints in the rib cage. And if I try to be more specific, it's the joints in front of the chest, and usually occurs in young people, but it can occur at any age. And usually pain is localized, may show one or couple of sides, or maybe 3 or 4 sides, and pain get worse at depth of respiration. It is not typical of pleurotic type chest pain. And this is about costochondritis. It is a cause of musculoskeletal chest pain because it's mainly skeletal in origin, and sometimes it may give rise to pain when patients twist like this side by side and try to move down and try to move up. Any movement which, and sometimes arm movements and lifting objects also, because any movement which puts pressure on these joints can trigger or can increase the pain. Therefore, it's a one type of musculoskeletal chest pain, and occurs in young people and patients present with musculoskeletal type chest pain, which I have explained some characteristics. And some patients may be anxious and they are panic as well. Okay, that's about costochondritis, and it's a reminder at end just to subscribe my channel and also hit the bell icon, and please leave a comment mentioning that I have subscribed your channel, and comment section is also open for your queries. I'll be there to reply you. Bye bye. See you in my next video.